how can you get pneumonia, a little bit about what it is, and what are the signs and symptoms of pneumonia. So what all that pneumonia means is that there is fluid within the alveoli. So in the lungs we have millions of these little tiny, very, very delicate membranes where gas exchange occurs. And when these become inflamed, then gas exchange is impeded and the person is going to have trouble with their breathing, and at this point then the diagnosis for pneumonia would be made. In your lungs you have, believe it or not, about 1,500 miles of airways. And about 300 to 500 million alveoli. Isn't that impressive? That's because these thin, delicate membranes need lots and lots of surface area to exchange all the gas that you need. Okay, so now that we've established that pneumonia is a diagnosis of fluid-filled alveoli, let's talk about how can you get it. There are three main ways. We will talk about all three of those. So the first way is just getting it in what we call the community, just out and about where you live. We call this community acquired pneumonia. So Streptococcus pneumoniae is gram-positive, so we'll color it in purple. And it is the most common bacteria to cause community-acquired pneumonia. The second way that people can get pneumonia is by aspirating something. So we call it aspiration pneumonia. And an example of this is if an elderly person has weak swallow muscles, and maybe they even aspirate a little bit of the water that they're trying to drink. So here is a picture of an alveolus. So here's, like up here we had some alveoli, these little tiny delicate gas exchange membranes. And then here's another example down here, a close-up of it. And little babies are more likely to aspirate while they're drinking milk maybe, or if they inhale meconium when they're being born, or other problems like that, just because they're little. So the babies might inhale something. An elderly person might have weak swallowing muscles. And then another situation where this can happen is if someone vomits and then they aspirate their vomit if they are unconscious. The most well-known, notorious example of this is if someone gets so drunk that they are vomiting when they're already passed out, and then they can aspirate that vomit. So any of these can lead to what we know as aspiration pneumonia. And one thing that makes this worse for babies is that normally our alveoli are protected by alveolar macrophages, white blood cells, but newborns lack alveolar macrophages, making them more susceptible to pneumonia. I also want to point out here then that community-acquired pneumonia is most likely to start with a viral infection that damages the mucosal membranes. So it damages the respiratory cells, and we know that damaged mucous membranes leads us open to bacterial infection. And so that can lead to then the bacteria that are infecting the alveoli, causing inflammation and causing then pneumonia. But in this case, there's actually a foreign body that goes down into the lungs, and it could be a piece of food that a baby ate, or like I had mentioned, meconium when the baby's being born from the amniotic fluid. With elderly people, it could be even just a little bit of water, and then of course stomach contents if it's vomit that's aspirated. So newborns lacking their alveolar macrophages would be more commonly known to get aspiration pneumonia. Okay, then the third type of pneumonia, or way to get it, I guess I would say, is hospital associated, or what we would call more specifically ventilator acquired. So ventilator acquired pneumonia. So this is when a patient is hooked up to a ventilator, then any kind of bacteria that are already in the hospital environment are able to get into the lungs of that patient more easily. Sadly, they are probably already more immunocompromised than a healthy patient, and so they are more likely then to get this hospital-associated infection. I'm going to put some gram-negative rods here because the most common, at least at this time, I mean it's a little bit of a moving target, but the most common bacteria to cause ventilator-acquired pneumonia is Pseudomonas aeruginosa. It loves air. It's an obligate aerobe. Now, I should, though, say any bacteria in the hospital could cause ventilator-acquired pneumonia, but at my most recent reading, Pseudomonas aeruginosa, this gram-negative rod, is the most common. Okay, then let's go on to what are the signs and symptoms. So there's going to be about 5 different symptoms that I will explain to you. The first is a productive cough. Which of course can spread the disease. Although most healthy people are not going to be susceptible. So they're going to have an increase in mucus because of the inflammation in the lungs, and they will produce phlegm. So that's one symptom, an increase in lung mucus. Okay, the second symptom that you can learn about is cyanosis. So if we look at their hands or their lips, there might be a blue tinge. And that indicates there's not enough oxygen in the blood because gas exchange is impeded because of the fluid-filled alveoli. So let's go ahead and make those fingertips blue. And this is a decrease in oxygen saturation. We call blue extremities cyanosis. And then we see that in the fingernails, the lips, and the gums. The next thing we can look at is a fever. Third symptom of pneumonia is a fever and chills. When our temperature is going up, we feel cold. When our temperature drops a little bit, we feel hot and sweaty. And oftentimes during a fever, there's fluctuation as our temperature is going up and down and up and down. And this is due to pyrogens. These are this word means fire causer, and it indicates that something about the infection is causing our brain to reset our thermostat at a higher temperature, and that's why we end up with the fever. Pyrogens can be released either from the pathogen itself or from our immune response or from our own cells. So sometimes our own cells, in an attempt to ward off the pathogen and inhibit it from multiplying, will release pyrogens that cause us to have a fever. It's our way of fighting back. There are some kinds of pathogens, however, that are able to release their own pyrogens and cause the body to have a fever. So it can be one or the other. Okay, the next classic symptom is what I would call snap, crackle, pop. And I want to see if you can think of what that is. Snap, crackle, pop. This refers to crackles on lung auscultation, or listening to the lungs with the stethoscope. Crackles on lung auscultation. So this is when the provider puts the stethoscope to the back of on the back and has the patient take deep breaths. And if they can hear a crackling sound in the lungs, that indicates that there is fluid moving around in the alveoli. And that, of course, is the basis for diagnosis of pneumonia, is fluid-filled alveoli. Okay, then the last symptom is pain when the person is trying to breathe. So here we'll draw a couple of lungs. And they have pain when breathing. Especially the inhalation part. And this is due to prostaglandins that are released from our damaged cells in the alveoli. Prostaglandins are chemicals that our damaged cells release, and when they do that, they cause our pain nerve endings to be more sensitive than normal. Here, I'm going to have to turn the paper sideways to do this part, sorry. Okay, then the last thing I want to take a moment to talk about in this video is pulse oximetry. So this is something that's really common now. Just going into the doctor for a physical, they are going to put one of these little gadgets on your finger, and it will come back with a reading, hopefully, of something like 98% or something like that. And generally, it's a quick way to see how much oxygen is saturated in the blood. And so it's a really quick way to be able to tell, is the patient getting enough oxygen in their blood? Decreased oxygen saturation can be indicated by a pulse oximeter. And if a patient has cyanosis, you're not going to be surprised to see that decreased oxygen saturation. I do want to say, though, warning, if you already know the patient has poor circulation, then this is going to give a lower reading than it would otherwise. So watch out for that. Okay, I'd like to take just a moment to review this entire page. So we talked about pneumonia. The diagnosis for pneumonia is based on a sputum culture. And sometimes an X-ray is done to look for cloudiness. And a healthy lung should just appear black, so the cloudiness could show signs of infections. If there is fluid-filled alveoli, it's because of some kind of inflammation that's going on because of irritation or infection. Our alveoli are the way that we do gas exchange. And if for some reason the alveoli are fluid filled, gas exchange will be impeded. Okay, so how can you get pneumonia? There are three main ways. Community acquired, most likely a secondary bacterial infection of Streptococcus pneumoniae. The influenza virus can damage our respiratory cells, and when that mucous membrane is damaged, then strep can come in and cause an infection. Aspiration pneumonia is when a foreign body gets into the alveoli, causing inflammation and also acting as a nexus for potential bacterial infection as well. Babies, if they inhale something, lack alveolar macrophages and are more likely to get pneumonia. Elderly patients may become very weak in their swallowing muscles, especially after surgery. And they may be more likely to inhale even little bits of water. And if a patient is unconscious and vomiting, they may aspirate some of their own vomit. So those are three typical ways aspiration pneumonia could happen. And the third way is ventilator-acquired pneumonia. This is a hospital-associated infection. And so it could be any bacteria that is present in the hospital. But the most common bacteria that gets in a ventilator to cause pneumonia is Pseudomonas aeruginosa, which is an obligate aerobe. And at the time of this writing, the most common pathogen to cause ventilator-acquired pneumonia. Okay, then I went over 5 signs and symptoms of pneumonia. One is because of the inflammation, there will be increased mucus production in the airways, resulting in a productive cough. Number 2, because of the fluid-filled alveoli and impeded gas exchange, there is decreased oxygen saturation that may be visible by cyanosis in the fingernails, lips, and gums. Third, pyrogens may be released from the pathogen or from our own cells. Those will cause our hypothalamus to reset the thermostat and cause a fever. Fourth, the fluid in the lungs may be heard with a stethoscope and they sound like crackles in the lungs. And fifth, the lungs will become very painful when the patient inhales because of prostaglandins that are released by our own damaged cells. These sensitize our nerve endings and make our pain nerve endings more likely to trigger action potentials, and then we feel pain. Then I wanted to just mention pulse oximetry, which is a nifty little gadget that's placed on the finger to get a quick indication of how much oxygen is in the blood. However, if a patient already is known to have poor circulation, beware that this technique will produce a lower reading than otherwise.